Hi, everyone, and welcome back to another COVID-19 update with Dr. Manfred Green, Director of the University of Haifa's International Master's Program in Public Health and Global Health Leadership, hosted, of course, by the American Society of the University of Haifa. So after another week of vaccine controversies and widening disparities in COVID cases around the world, Dr. Green, we're once again delighted to welcome you back with us to make sense of an ever-changing situation surrounding the pandemic. Now, we're going to start today here in Israel, where it's estimated that around 68% of the population are likely to have antibodies in their blood, which can fight the virus, be it through vaccination or recovered from the virus. So the question that is being asked here is, has Israel reached herd immunity?
Well, thanks very much, James. I think, again, we're talking about the concept of herd immunity, and just to remind everyone that it's a kind of a dynamic concept and it can be changeable. So we're talking about an average for the population, and certainly in Israel, we've seen a dramatic decline in the number of cases. In the number of severe cases, it's been really very dramatic. And you just every day see the number of severe cases hospitalized dropping daily, and virtually no new cases. So it's certainly been very successful, particularly in the older population. So we reached a stage, I think, where if you think about it generally, for the virus to actually transmit, it needs people who are not immune. In other words, they haven't either been ill or they're sick with the virus, or they haven't been vaccinated. So now the virus has to be more active looking for people who are not vaccinated, and it's more difficult. So the virus then reaches a lot of dead ends. In other words, it might be somebody may be ill. Around that person, there are not enough people or very few people who don't have antibodies, in other words, who are immune basically. And then the virus basically has nowhere to go, and basically that little chain dies out. So we've basically now seen a very good reduction in that transmission and the interruption of these chains. So we are approaching what we might call a kind of a herd immunity. Remembering, of course, that herd immunity is an average concept. We still have pockets that are not vaccinated, and there could still be small outbreaks there. And of course, we're part of the rest of the world. So as soon as people from abroad come in, with all our good intentions to identify them, it's not going to be that easy. So you could introduce it, and then those who are not immune become basically very much at risk of disease. If you're talking about 70% of the population being vaccinated or immune, if you add the people coming in, let's say another 10% come from abroad, that 70% changes. And so you lose that kind of or to some extent, you lose that advantage.
Yeah, and we'll come on to that topic a bit later, the
right.
topic of international travel. But meanwhile, while Israel continues to stride towards normality, worldwide, deaths are on the rise again, with the likes of India experiencing surging numbers in infection rates. As countries continue to focus on protecting themselves against the virus, how important is a worldwide effort to combat the virus if we are to fully move past COVID-19? And what are organizations such as the World Health Organization doing to achieve this?
Right. Well, we are now encountering a virus, as we've described before, that has become very efficient in transmitting in humans. Because we remember these are viruses that originate in animals or non-vertebrates and so on. Or so we say, not just in vertebrates, but in animals and birds. So what's happening is that this virus now, which would normally be poorly transmittable amongst humans, has become very, very effective. And it's become essentially a human virus in the sense that it transmits. So there's not much else that you can do to really restrain it other than to vaccinate, unless you just allow people to get sick. And because this virus does cause severe disease in a certain part of the population, you're really left with this kind of choice that you really either vaccinate or you very much restrict the contact between people. And that's a very difficult decision. So what's happening in the rest of the world, or shall we say a lot of the rest of the world, where there's not been high levels of immunization yet, they are still encountering the situation where they have to basically separate people, wear masks, stop gatherings and all the rest of it, just to interrupt the transmission of the virus. And again, we're a part of that. I mean, Israel's part of that at the end of the day. Sit back and say, okay, we're okay, because we're not really an island. No man is an island. So basically, we are going to have to be part of the worldwide effort to at least to get control of this virus.
Mm-hmm.
And the WHO, the World Health Organization, is the body that leads this effort. And I think that this is a time to say that countries such as Israel should be sharing their vaccine. And that, I think, is a little bit of a disappointment to me, that we are not sharing it, particularly with our neighbors. And I know that I've repeated it more than once, but I think it really is a mistake for a number of reasons, both epidemiologically, also in terms of protecting the population, and also morally, that we are not actually supplying vaccines or making sure that the Palestinians in the Palestinian Authority are getting vaccines. So I think these are things, and this is just one example. I mean, all of us have to look at our neighbors and say, can we help? Otherwise, we're all in trouble.
Yep. Now, against the backdrop of increasing numbers of vaccination throughout the US, with nearly, I think, a quarter of all Americans now fully vaccinated, states such as Florida and Michigan are continuing to see surges in cases, with hospitals reportedly reaching near full capacity. How much bigger a challenge does the US face to reach a similar situation to which Israel currently finds itself in?
Right. I think we spoke about it before, that the spread of an infectious disease is not just a function of the way the virus spreads, and not only the immunity from the vaccine, but also the size of the population.
Right.
I'm talking obviously now in big numbers. I'm not saying that we are like very country, small villages, but in the days when, in fact, there were small villages and people, didn't live in large communities, viruses were less effective. Something like measles, for example, would spread less effectively. And you have cases where, in fact, you saw populations increasing in certain areas way back, and then suddenly there were big outbreaks of measles, because the virus needs non-immune people to spread. And it's just like a bushfire. It needs dry stuff around it to keep spreading. And if you actually clear all the bush around it, it has trouble spreading. So basically, in the US, it's a much bigger challenge, because it's a much bigger country and a population which is 40 times or whatever the size of the Israeli population. So I wouldn't be surprised if you would need vaccination rates for so-called herd immunity higher than we would need in Israel. So you would really need to get like virtually 80% of the population there vaccinated before you really will have a major impact. But you could see it earlier, obviously. The big thing, though, is you mentioned that a quarter or a half are being vaccinated, or a quarter were fully vaccinated, and up to a half have reached that, they've received at least one vaccine. But if you look at that carefully, you may say, well, if it's the elderly population who have been fully vaccinated, then you certainly will see a dramatic drop in the deaths, in the severe disease, because this virus particularly affects elderly people much more seriously. On the grand scale, there'll still be many cases of young people getting sick and getting very sick. So again, it's a question. I might even just mention that there have been some calculations just showing that if you just look at the what we call years of life lost, in other words, how many years do you lose if you die at a certain age? When somebody dies at the age of 80, let's say they lose 5 years of life expectancy, but someone who dies at the age of 40 loses 45 years. So one death in a young person in terms of years of life lost is worth so many more years of life lost in an older person. Right. So this is something you need to remember, that it's not an equal distribution. So that even if the elderly people are being protected, we're going to still see what we would say a burden of disease in the younger people.
Mm-hmm. Interesting. So we've already talked extensively about the blood clot issues around the AstraZeneca vaccine. Now, Johnson & Johnson is the latest COVID-19 vaccine to be paused after 6 people recorded blood clots post-vaccination. Now, is Johnson & Johnson based on a similar technology to the AstraZeneca vaccine or the mRNA technology used with Pfizer and Moderna? And do we know anything more about the causes for these rare blood clots?
There are attempts now, and there is some information coming out to indicate why these so-called viral vector vaccines may be more implicated in these kind of rare thromboembolic events, in other words, the blood clots. So it's still rare. In other words, we're still not seeing many cases. I think that they talk about 8 per million and things like that. But, this is the situation where I'm not saying that it's not a problem, but when we look at a disease like smallpox, quickly to give it, smallpox will kill 30% of the people who get smallpox and cause basically a lot of damage to some of the others. So basically, you have a very great interest in getting vaccinated against smallpox, even if there is a risk of other illness. And the smallpox vaccine has quite a number of side effects in a certain percentage of the population. So basically, but you would say to yourself, but if I get smallpox, that's going to be really bad. So I'm going to take the risk and have a vaccine that has some risk. In the situation with COVID-19, we're in a somewhat more difficult situation, particularly in younger people who will say, basically, we get vaccinated to protect ourselves, but our risks are still pretty small for severe illness. So we're really part of a sort of a community effort to get this disease down to level. And that's when it makes it much more difficult to persuade younger people to get a vaccine that has a relatively, shall we say, high rate of side effects and some serious side effects. So this is the real issue at the moment. If in fact, if I tilt the balance and I said, if we're going into an area where in fact we have, let's say, the AstraZeneca vaccine, and we have elderly people who are not vaccinated and there's a lot of COVID around, it makes a lot of sense to give them that vaccine, even with the slight risk of blood clot. Right. Where it starts to become more problematic is with younger people, and particularly with younger women, because it's seen primarily in young women, or women particularly. Yeah.
Okay, and the final question for today, and I want to make sure we get to this, it is around international travel, and it's a topic we've received a number of questions on from our audience. So there's been a lot of talk recently around COVID vaccine passports potentially being a part of international flights. It's a system that's worked fairly effectively in Israel for restaurants, gyms, and live events. Do you think this is something that can realistically be administered for international travel to resume safely?
Yeah, I think there are a couple of things. Let's, again, distinguish between the internal passport, where you're going to restaurants and stuff, and an international one where you're moving from country to country. I'll give an example quickly of what I experienced, because I now would travel to Denmark and I came back now. So when I left, I got tested, and when I arrived, I got tested. And again, when I left Denmark, I had to have a test 24 to 48 hours before. And then when I arrived in Israel, immediately at the airport, I was tested again. It worked very well, by the way, very efficient and actually very easily done. But I must add, a strange feeling when you're at the airport these days. Well, very few people, very empty. The runways are just, standing empty. Planes are just standing there waiting. So you really are in a situation where it's pretty easy to do. You arrive, you do all these tests, it goes quickly. If in fact they open up now and have, now they've got a couple of dozen flights a day, maybe in Israel or whatever coming in. So let's push that up to 100, 200, 500 flights. Think of Atlanta or JFK or whatever it is. And you have to test everybody, and everybody has to arrive with a test and then leave with a test. That's a huge operation. Mm-hmm. So it does make sense until people get vaccinated. So you ask the question, well, would it be enough for me to show a certificate? The big issue here, and that's going to be an international discussion, is which vaccines do we recognize?
That's right.
And in fact, at the moment, even with yellow fever and things like that, which have required vaccination certificates and previously smallpox, there was a general recognition because there were a few recognized vaccines internationally. The WHO certified these vaccines.
Mm-hmm.
Now there are a number of vaccines on the market, and there are many more maybe that are coming onto the market. And we don't really know the efficacy of many of them. And they haven't been approved by any of the so-called Western, shall we say, bodies. And that doesn't mean that they're not good. So we need, very urgently, we need international collaboration. The WHO, as I understand, trying to coordinate that, which means that every vaccine now, for the vaccine passport, for international travel, I would guess you will need to get a vaccine that's internationally recognized.
Okay.
And that's going to be an issue. So obviously that's going to require a lot of collaboration. The Chinese, by the way, are showing good evidence of collaborating because they are actually giving evidence of the efficacy of their vaccine. So there is a vaccine, I think Sinovac, which they themselves say is only about 50% effective, unlike the Pfizer, which is well over 90% effective.
That's right. That's
so
right.
you may argue then that there will be, that even the Chinese will agree that for international travel, they would need the Pfizer vaccine. It's going to be basically international bargaining.
Yeah.
And it should be done through the World Health Organization.
And then we could be in a position whereby you could travel on a Pfizer vaccine, but you might not be able to travel on, say, an AstraZeneca vaccine.
Well, it is a possibility. The requirement may be that you need an approved vaccine, not just a vaccine. And that's going to recreate, obviously, issues of what is an approved vaccine.
Right.
By the way, even though I'm vaccinated, I still have to be tested before I left and tested when I arrived. So there's still this possibility of carrying the virus, even though you're vaccinated. But in the future, if the large percentage of the population are vaccinated, we hope that that'll be much less necessary.
Right. Right. Dr. Green, thank you so much. I'm afraid that's all we have time for. But if any of you out there have any questions that we weren't able to address today, please do leave them in the comment section of this video, and we will do our best to address them at a later date. Thank you all for tuning in, and we'll see you on our next brief.
James, can I make a quick comment that maybe next time we should talk about vaccinating children?
Absolutely. Absolutely.
Okay.
Thank you, Dr. Green.
Thanks very much, James.